Welcome to the 7th installment of our Pharmacy Experts webinar series. The title of our webinar tonight is Pharmacy's Role in Population Health. I want to thank you for taking time this evening to join us for the webinar on this very interesting and important topic that will describe the ongoing population health program at Fort Healthcare in Fort Atkinson. Our UW School of Pharmacy alumni at Fort Healthcare are at the cutting edge of population health programs in rural areas. One of the main topics tonight will be how pharmacists in leadership positions and pharmacy departments in health systems can leverage their expertise to design, implement, and evaluate population health programs in rural communities. My name is Dave Mott, and I am the Associate Dean for Advancement at the UW School of Pharmacy, and I will moderate tonight's webinar. This event is being sponsored by the UW School of Pharmacy Advancement Office. I want to acknowledge and thank Alyssa Carmacki, our Alumni Relations and Advancement Coordinator, Anna Reinhardt, our Event Coordinator, and Jasmine Loving, the Dean's Office Assistant, for their work marketing and producing this event. Before we get started, I want to describe the process we will use for taking questions. First, the chat function is turned off for attendees. Second, due to the number of attendees, we will not be taking verbal questions. Instead, please use the Q&A feature on Zoom to type and submit your questions as you think of them. Since some of the questions may be the same across individuals, please feel free to click on the thumbs up icon to upvote a question. Then, during the Q&A session, I will read the questions with the most upvotes for the panelists to answer. The webinar is being recorded, and we will send you a link when the recording is available. We also will be sending you an evaluation of the webinar tonight. So let's get started. Our webinar panelists this evening are three incredible UW School of Pharmacy alumni: Chris Barron, Tyler Prickette, and Tony Knutson. Chris Barron earned his BS degree in pharmacy from UW in 1997 and an MBA from Carroll University. Chris is the Executive Director of Population Health and Clinical Services at Fort Healthcare, an independent hospital and health system in rural South Central Wisconsin, and has been in this position since 2015. Chris leads Fort Healthcare's internal and external population health and health equity strategies. Chris serves on the board of directors for the Wisconsin Collaborative for Healthcare Quality and as board representative to the collaborative's health disparity initiatives. Dr. Tyler Prickette earned his PharmD degree from UW Madison School of Pharmacy in 2017 and earned his BS-PS certification in 2020. Tyler is the Director of Pharmacy at Fort Healthcare after joining Fort Healthcare in 2019 as a clinical pharmacist and practicing in an ambulatory care role. Tyler's role allows him to work throughout the health system to advance pharmacy practice in all avenues of healthcare for the benefit of the patient and the system. Tyler is involved in the community by being the co-chair of the Jefferson County Drug-Free Coalition and a member of the Jefferson chapter of the Knights of Columbus. Dr. Tony Knutson earned his PharmD degree from the UW School of Pharmacy in 2020, completed his PGY1 residency at Fort Healthcare. He is a board-certified pharmacotherapy specialist as of July 2020. Tony currently is a clinical pharmacist at McConnell Air Force Base in Wichita, Kansas. He recently made the move from Wisconsin, where he previously worked as a clinical pharmacist at Fort Healthcare. Tony has a strong passion for improving the transition of care across a patient's healthcare experience and is continuing his relationship with FHC through contract employment to grow the primary care pharmacy service line by working directly with primary care physicians to improve guideline-directed medication access to patients in the community. Tony is an avid fitness enthusiast and continues to enjoy watching people reach their fitness goals through coaching Olympic lifting. And thank you, Chris, Tyler, and Tony for joining us this evening. So to get started, Chris, what is population health and/or population health management? And what does that look like at Fort Healthcare? Hey, Chris, you're muted. Sorry.
Thank you. Start over. So again, thanks for having us, Dave. The widely accepted definition of population health comes from an article titled "What is Population Health?" from Doctors David Kindig and Greg Stoddard in 2003 issue of the American Journal of Public Health. They describe it as a concept of health that is the health outcomes of a group of individuals, including the distribution of such outcomes within the group. These populations are often geographic and take into health factors, health determinants, and policies and programs take into account those things. So what we're really talking about here are geographic denominators when we measure it. In our case, for the sake of measurement, we consider Jefferson County as our geographic denominator we look at. What I'm showing here again is a graphic from the county health rankings that shows what this model looks like in practice. Health outcomes, health factors, policies, and programs is the way it is broken down there. We also consider this thing called population health management, which the American Hospital Association defines as the process of improving clinical health outcomes of a defined group of individuals through improved care coordination, patient engagement, supported by appropriate financial care models. So this is really a clinical denominator for Fort Healthcare patients, or Fort Healthcare patients with diabetes, for instance, is the way we look at that. So our, I'm sorry, try this again. Try to advance the slide. Our mission, vision, and values at Fort Healthcare have been centered around population health and health equity since 2010, really. And as you can see on our mission map here, that depicts our well-defined population. Our partners are depicted there. And the paragraph that I call out there really begins to recognize the impact of the various health factors on our community's health. It's very community-focused message that extends beyond our walls and really invites collaboration with our community.
You, as a pharmacist, come to lead population health at Fort Healthcare?
Coming up to that, I apologize, I'm stumbling a little bit. All right. Is my slide still up? So my role as executive director of population health at Fort Healthcare was established in 2015. And it encompasses population health management, and health equity. I was asked to be the first at that time. I was the pharmacy director and had proven myself as an organizational level problem solver, had a track record of using analytics to drive improvement, had an aptitude for IT, and had well-established relationships with medical staff. So we had their credibility and trust. So although we had a very population health focused mission and vision for about 5 years already, we had a new analytics platform that needed to be stood up. So that was my first task in this role, really. So I moved to administration at that time, to administration suite, and report to the CEO. And I'm not a population health pharmacist, but a population health executive that happens to be a pharmacist, if that makes sense. And actually stepped away from pharmacy for a few years. And it wasn't until a few years ago that pharmacy and 5 other departments are brought back under me.
Speaking to our rural health students, and have mentioned how in many ways population health is uniquely suited to rural healthcare. What do you mean by that?
Yeah, for sure. First of all, I grew up in a town about 10 miles from here called Milton, a small town. So I have roots in the rural communities we serve. And my perspective of rural really isn't one of deficit, but one of asset. We have a lot of assets in our rural communities. Rural communities, the ones I know are proud and independent. We care for one another. Our mission map, again, depicts many of those relationships. Our population is also of manageable size. It's about 85,000 people in Jefferson County, so it's not so massive. We can't really touch everyone through our health system. Our health system's the largest health system in the county and one of the largest employers. So we have a lot of touch points with our community. Even more so as we layer in our clinics and services such as school nursing.
Mentioned programs as an essential component of population health. What are some recent or current programs or projects you're working on at a population health level?
Yeah, we're just a little small town hospital, but we tend to work some pretty big projects. I've co-authored and project directed a federal HRSA grant from the Health Resources and Services Administration under HHS, which was one of several grants we were working back in 2019. The grant I co-wrote and directed was a quality improvement grant called Improving Diabetes Care for Healthier Communities, focused on equitably improving diabetes care. We also worked a HRSA network development grant that funded the consolidation of our charity safety net providers into a single, more sustainable entity that's on the path to become a federally qualified health center. We've partnered with researchers, some here at the School of Pharmacy. We've done projects with opioid prescribing with School of Pharmacy and other partners. We've worked with the School of Nursing on mammography initiatives. We're working with UW ophthalmology researcher and the National Eye Institute to improve diabetic eye screening rates in rural populations. So those are a few of the projects we worked on. Right now, we're building on our prior work with the Community Health Center to advance health equity by measuring and reducing health disparities between our populations.
Diabetes Care for Healthier Communities program had a pharmacy component. How did that come about and how did that project go?
Yeah, having a background as a pharmacist, I know the value pharmacists can add when they're at the table. So it's so valuable to get us at the table for these discussions. So when I co-wrote that Improving Diabetes Care for Healthier Communities project, I broke it into 9 sub-projects. One of those was specifically about advancing primary care pharmacy services. I wanted to get that placeholder in there to ensure that was sort of a jumpstart for many of our services. And we're building off the opioid focus work we were already embarked on with the UW School of Pharmacy. So we had that model kind of in place. We had the next project kind of teed up, and we wanted to make sure we made pharmacy part of that. We had proven a pharmacist could add value, layered in the diabetes side as part of an approach to team-based care. And Tony can tell us a little bit more about that experience.
Yeah, thanks, Chris. So, yeah, really for me, coming in, and Tyler was in the position prior to me, so I kind of just took the work that Tyler was doing and also ran with it. But really, in terms of being part of the HRSA grant, being able to collaborate and partner with our comprehensive care management team and diabetes education teams really gave us an opportunity to see the work that they were doing and not duplicate any of the work that was already being done. It also really increased our visibility as a healthcare partner to provider groups and the rest of Fort Healthcare. And it really kept us in the loop of what our organization goals were for this specific population. So it really gave us, a good idea of like where we needed to go with primary care services line.
through the rural health track at the School of Pharmacy. You rotated at Fort Healthcare and ultimately completed a PGY1 residency there. And I understand you had a residency project that was longitudinal and very population health focused. Can you tell us a little bit about that project?
Yeah, absolutely. I'd say, I mean, just because I'm partial, I'd say that my longitudinal project for my residency was the best project, obviously. um, but really, the aim of my project was to establish a pharmacy collaborative, which was aptly named the Pharmacy Collaborative of Jefferson County. And really, what we set out to do was create a collaboration between Fort Healthcare and our surrounding community pharmacies dispersed around Jefferson County. And the goal was really to open up lines of communication in hopes to gain insight into the needs of those community partners. We also wanted to establish ways we could help each other deliver more comprehensive care to our patients that we serve. This work really continued after my residency as I took over that primary care role, and played a part in being able to have those contacts and be able to communicate with those outpatient pharmacies about specific patients and making sure that patients are adherent to their regimens, that sort of thing. And it actually has also impacted our inpatient side, where we've been able to send discharge summaries to those pharmacies when medication changes are made, especially on med packaging and adherence packaging patients, so that nothing is missed when they're discharging back into the community.
Chris in the C-suite, Tony has boots on the ground. Kind of where is your head at as director of pharmacy with Fort Healthcare Population Health Initiatives?
Absolutely. I think being in a director of pharmacy role really puts you in an advantage to understand both the administration's perspective on what outcomes we're looking to improve as an organization, along with understanding the ins and outs of how a pharmacy department should function, and how to best position some of your pharmacists to make impacts on those outcomes. So like Tony said, I had been in the ambulatory pharmacist role, what we're now calling primary care pharmacists, prior to him taking over that role. And it really gave me an advantage to understand what it takes to impact population health management outcome. I was primarily focusing on pain management and had adapted along with our HRSA grant to start working on improving diabetes management as well, really positioning Tony well to, like he said, hit the ground running and really make an impact on our patients that we'll talk about later. And it just kind of couples from there. So I get chances to build relationships with our C-suite leaders, other managers, and look at organizational goals such as improving the blood pressure of our population, and trying to develop ways for us to take on these population health management outcomes and utilize our pharmacist team to the top of their license to improve the health and well-being of our community.
So evidence of improvement and other outcomes are important in population health management. Can you speak to any outcomes from pharmacy involvement with population health initiatives at Fort Healthcare?
Yeah, I can. And before I do that, I think my slides can probably be seen now, right?
Yes, we can see that.
Excellent. So yeah, I apologize before I was partway there and I didn't click the second button. So before I do that, I'll just show the graphic I had up before, which is that of the county health rankings, which speaks to health outcomes, health factors, and policies and programs, as well as our mission map here that speaks to our partnerships, our well-defined relationships within the community, our well-defined population, and then that population health focused mission that begins to talk about those various determinants of health and how they impact the health of our population. Now back to the data question. Yes, we do collect a lot of data on various initiatives, and that becomes a key aspect of what we do at Fort Healthcare. I gotta skip ahead here. So on the data side of what we do with the improving diabetes care for healthier communities, we had a data scorecard we tracked on this. And we track performance over time on a variety of measures. Here and this view here, I blacked out some of the irrelevant ones to focus on two of them, on the A1C less than 8 and the A1C less than 9. And those are two areas we focused on as part of the team-based approach during the project. And as we can see from grant year 1 to 2 to 3, we saw some improvement. But more importantly, we really sustained improvement since that time and actually improved since then. So those are some of the data points we had at the big picture view of how pharmacy as part of a team could achieve some measurable outcomes that we were tracking for sake of the grant. We track these for value-based purchasing and all as well. So that's become a real bright spot with our value-based metrics. Tony can add some case examples to this as well.
Thanks again, Chris. I don't know if you can switch to the next slide. Perfect. Yep. Excellent. Yeah, so we did want to share a little bit of clinic data that we gathered over the last year. So basically all the data that you're seeing on the slide here is from January 1, 2023 through about September 2023. So our upper left chart shows the total number of visits that we did in that time. The blue pie piece is diabetes visits and follow-ups, and then the red is all other patient visits. And you can see the diabetes patients certainly took up a big chunk of time and necessary visits and follow-ups. The upper right chart shows some of our A1C data. So we had 24 patients that were included in those 142 visits. And basically what you can see is at initial A1C, they were around 9.7, and we've got a nice trend line going down, which is what you want to see, especially when you're following up so closely with these patients, where at first follow-up, it was decreased, and then at second follow-up, it was decreased even further. So looking fantastic there. And the lower left, just to show that this is not just pharmacy work. This is a collaboration with many health partners, but specifically these 24 patients, we had a lot of collaboration with our CCM and diabetes education team. So you can see, about half I was consulted alone, or pharmacy was consulted alone. Most likely those were medication related things like med acquisition and things like that. But a lot of times we were collaborating with those CCM and diabetes education. And then the lower right, just wanted to show a breakdown of the distribution of insurance types. So we didn't have any uninsured patients, but you can see the vast majority of our patients were either commercially insured or Medicare. And we'll talk a little bit more about barriers to care a little bit later on here. So overall, really what this shows is that in order to have a more significant impact on a disease state like diabetes, we really need a team approach with closer, more frequent follow-ups with patients.
Data is certainly impressive. So it sounds like the ability of pharmacists to engage in patient care activities in your clinics that move metrics that matter the most to administrators is a key component of the collaboration between administration and pharmacy. How are you making this sustainable for the system?
That's a really good question, Dave. And I think it comes down to the top right chart that Tony had showed, and it's getting the outcomes. And primarily what we want to focus on with having such a history of population health goals as a system, we're really looking to try and make those impacts and the outcomes. And that comes back to value-based reimbursement dollars for the system as well. So it's really, really beneficial to have data and be able to show information like that top right corner, because not only, as we all know, pharmacists have struggled getting advantageous billing in clinic settings for a long time. I will say we all know that's also changing here soon with Wisconsin Medicaid acknowledging pharmacists as providers here. So we'll have more opportunities to make this sustainable in the future. But we've really focused and tried to accentuate those outcomes that we're getting to justify having pharmacists in roles in the clinics. And again, it goes back to having that mission and vision focus of the organization, where we can position our pharmacists to make an impact on our patients' lives.
Barriers. So what have been some of the key barriers to your patients meeting their healthcare goals, and how have you as their pharmacist helped them overcome those barriers?
Yeah, I think one of the major barriers for us is I'm the only pharmacist out there, and Tyler was the only pharmacist out there when he was out there. And we've got 7 clinics that we cover, and I think about 14 providers. So having that as just one barrier, I mean, even if I go to one clinic, a day per week, you're still only in a clinic every 2 to 3 weeks. So a lot of our, provider engagement can be impacted that way, but also being able to do in-person patient visits. So a lot of our visits were via phone, which sometimes is more convenient for the patient, but it does take away a little bit of that body language feedback that you sometimes get from a patient. So, that was a little bit challenging for me. It was nice to be able to, spend time on the phone with a patient. They can have their medications in front of them and we can go through them one by one, which was great. And it allowed us to have quick conversations to do more frequent follow-ups as well. The other thing for our patients is a lot of them are either underinsured or are lower income or fixed income. As you saw from the chart earlier, we had quite a few Medicare patients, and a lot of times these patients require a little bit more hands-on with medication acquisition. So doing a lot of that for like manufacturer grants and manufacturer coupons just to get people on the right guideline-directed therapies. And then we also dealt with a lot of health literacy challenges. So many of the patients that I was consulted on didn't fully understand their disease state or their medication. So providing that feedback and that education with those close follow-ups really felt like it had a large impact for those patients.
Before about collaborations, what have been some of the key partnerships that you've developed within the organization that have helped with the success of the program?
Yeah, I think first and foremost, the biggest relationship that's helped us have such success is with our providers. Having the opportunity to get face-to-face with our outpatient providers, which especially as hospital pharmacists primarily, we don't typically get to do. Being able to get ourselves on boots on the ground right in the clinics has been a big assistance to us being successful. Being able to be in their clinics and work directly with their patients, like usually right next to them, has really gained us a lot of favor with them and really showed what pharmacists can do when put in those positions. So we've really made ourselves invaluable from that perspective. The other partnerships we've made is with other department managers, whether these impact population health outcomes or not. we try and make ourselves the medication experts in every situation, whether it has to do with the clinical side or medication acquisition or using our electronic health record efficiently. We try and build those partnerships by being a looked upon colleague to really make everybody's lives easier, which ultimately improves patient outcomes. So, and lastly, I think we really try and build partners with leadership. The more we interact, not only as the department leader, but the more opportunities I give my pharmacists to interact with the leaders of our organization, the better they understand what our organizational leaders are trying to work toward. And we're able to really meet the expectations of everyone.
Relationships, but we know that population health relies on building partnerships outside of the healthcare system. What are some of the partnerships that Fort Healthcare has developed within the community, and how are they utilized to improve the population health goals of the organization?
Yeah, so I can cover this one, and I'll get to the slide in a moment here, but I spoke about our partnership with our community health center, Rock River Community Clinic. The network grant actually established a Rock River Healthcare Network as part of that grant with 8 community partners, which we're one of those, and that work continues to this day. So working outside of Fort Healthcare, we're working at the community level with those partners to address needs in our community, many times for patients that aren't seen at Fort Healthcare. So I'm a member of that Rock River Healthcare Network steering team, and we're currently scoping out our next community project addressing other needs we've identified in our community health needs assessment. But back to that Rock River community clinic work, my team has duplicated the measurement work we do here at Fort Healthcare, and we do that for Rock River Community Clinic. So I kind of failed to mention this part of that project is a condition of the network grant was to assure Rock River had an electronic health record as a condition of becoming a federally qualified health center. So we extended our electronic health record to the community health center, as well as our analytics capabilities that me and my team provide. So all the work we do here, we duplicate for them. So now we can measure how well Fort Healthcare population performs on a variety of health measures, and how well the Rock River community clinic population performs. And they're a very different population. They're an 80% Spanish-speaking Hispanic population. So now we compare those two populations in our community and can actually identify and track health disparities, which is what you see here on the screen, our health disparity tracking. And we can work together now to reduce those disparities over time. We actually sit on their quality improvement team. We have a meeting tomorrow, and we use this data to drive improvement on the community level, and actually really it starts a lot of great conversations in our community about what health disparities look like in our community, and really starts to rally support around reducing those. The work we do here, we didn't just make this up. I'd love to say we did, but this is modeled after work being done by the Wisconsin Collaborative for Healthcare Quality and their partners. And we're a member of that. We work closely with them. As we mentioned in the intro, I'm on their board of directors and work on their health disparity strategy there. But Wisconsin's done a lot of great work in this space on health disparities. So there's a lot of great models out there. If you look at wchq.org, health disparity, you can see how things are tracked at the state level. We essentially brought that locally and did that and started tracking these things locally with our other health partners. Our work in the future is to do this internally as well. So on the topic of health disparities, a thing I'd like to cover, and I know it's Dave's favorite graphic here, talking about health disparities and health equity. One way we talk about this when we talk about with our teams and with others is it's always easy to pick the low-hanging fruit when we're looking at care gaps and approaching efforts to improve health. when we do that, what we tend to do is reinforce or exacerbate health inequities in our community. So we use this to kind of explain that to people, that we need to think creatively how we reach further up those trees, as we layer in additional supports for those populations that might need those additional supports, so everyone in our community can achieve their best health outcomes.
I think I'll add just a little bit to this, is that, you know, other partnerships that we've built, in my bio, I mentioned that I'm a part of the Jefferson County Drug Free Coalition, and we've had, I think the partnerships that we built internally allow us to the opportunity to also get involved in the community and things like that. So initially, when we started our ambulatory care program, it was very pain management focused, and that Drug Free Coalition is something that has meant a lot to our community and is working again on prevention and meeting the mission and vision of Fort Healthcare, but done from a very public health and population health standpoint. So to be able to be a voice for Fort Healthcare and an organization like that directly in the community is also a really awesome opportunity.
Yeah, and just as another quick aside, you know, the collaborative that we developed during my residency has paid dividends and made connections. So one of our community pharmacies was starting to develop a wellness program, and we have a community health and wellness program at Fort Healthcare. So being able to connect those two so they could work together is a huge, you know, benefit to the community as well. So that, again, they're not duplicating work, and they can probably have a bigger impact together than just by themselves.
Impressive, Chris, when you had the slide about the data up there. I mean, I would think that having, you know, the data that you guys are able to collect, showing these comparative outcomes and trends over time, that has to be incredibly impactful to others in the community to facilitate those partnerships with Fort Healthcare.
Oh yeah, definitely. This data it's facilitated so many conversations in our community about what this looks like. Many times when we talk very abstractly about health disparities or social determinants of health, it's hard to put that into context. And when you show it with data, it adds that level of context, that we can show that the outcomes for our patients are different than the outcomes for other patients, or the measures that lead to outcomes for other patients are very different. And then using that becomes very powerful to improve things. So not only working at, say, the community clinic level, helping them reach their patients, but collectively working on efforts to say, so how do we support mammography vouchers in our community to reach all these populations. So we have a voucher program that provides vouchers for women that need mammography services across anyone in Jefferson County. We just did a large campaign for Breast Cancer Awareness Month and are evaluating that data now to see how that's impacted or closed some of the disparities we see. So yeah, very, very impactful.
Moving some of these metrics are going to require some best practices in pharmacy. So, Tony, what are some of the pharmacy best practices that you've utilized within the practice?
Yeah, I think really, you know, in the beginning part of the program, it was really letting providers know that I was in clinic with them, like being present, actually doing some prospective patient reviews on patients that they were going to see that day, with possible medication optimizations and consult candidates, just to kind of get the ball rolling a little bit, maybe garner some of their support and confidence in the program. Because I think that's really the biggest thing, is making sure that the providers know what you can offer. So that was a big thing. One thing that I do have to say is, if you're trying to bill for your services, you can't double book a visit with a provider and you the same day and bill for both. You'll end up, you know, making the providers kind of mad about that, stealing their their billing opportunity. So just as an aside, we were lucky enough, we don't bill for our services, so I could see a patient same day, but I felt like if I didn't say that, it might come up later on. So, the other thing is, going above and beyond for providers and just trying to take work off of their plate, right? That is one way to garner their support and really make your program take off, is adding that value to them. And then, of course, the collaborative practice agreement question is naturally going to come up. And certainly, you want to use CPAs to expand your practice. The way that we formulated our workflow early on didn't really require that, because we kind of circumvented that by proposing orders to providers. And we had pretty good relationships with the providers to start to be able to do that. But still something we're continuing to work on and develop as we're building this program to make it more sustainable for the future. The other thing that I really, feel pretty strongly about is having a good understanding of insurance and manufacturer grants and programs to help patients afford their medications. I think that, of those visits that we had and the consults that we had from providers, a lot of them just don't know how to get a medication covered. And if you can take that off of their plate in the beginning parts, it's going to really make you stand out. And that got a lot of attention from our providers when we're able to get medications through when nobody else could. So having that resource catalog of those is really big. And then, of course, Chris would be really disappointed if I didn't mention this: collect data. Whatever you do, just collect something, even if it's not right and you need to change course at some point. Collect something so that you can understand the impact that you're having.
Yeah, data only gets better when you start using it. So let's start somewhere.
Chris, you have this expertise in population health. You've been at this for a while. So what do you believe is the most significant factor or factors that's led to the success of Fort Healthcare's population health initiatives?
I'm going to say pharmacists. No, but we've proven our value here to, beyond just what you might traditionally consider pharmacy, and my role in the C-suite, and Tyler's role in pharmacy leadership, and Tony boots on the ground. It's beyond, providing services. It's building programs. It's tying these things together with the community. It's using our skills in many different ways to solve organizational and community level challenges, and really getting in tune with what those things are. So getting aligned with where the heads in the C-suite are, getting aligned with what the challenges in the community are with the community health needs assessment, which we're a big part of that. But the skills we have as pharmacists don't always need to be limited to medications. I mean, that just the problem solving skills of having good rapport with providers and data and IT and things like that. You can apply them in different ways.
So what can other pharmacists, we have a lot of pharmacists here attending tonight. So what can other pharmacists do to take on population health or population health management projects with their facilities that they're working at or within their communities?
I can start off and let Tony and Tyler pick up on that as well. But kind of back to what I just said, where we started a lot of it was really building our brand, building our credibility here at the organization. And that was about really becoming aligned with organizational level initiatives and priorities. And the more you're aligned with that, the better position you're in to be able to raise your hand and say, hey, I can help with that. becoming best friends with the quality department too. Early on, when I was a pharmacy director, that's one of the first places I spent a lot of time is with our quality manager at the time. And we did a lot of great projects together that started out to be very pharmacy focused projects, medication safety. But we built our brand and our credibility from that, and it extended into other bigger projects down the road. And then lastly, I'll hit back on Tony and data and my thirst for data, but really assessing how we measure success. And instead of measuring success by, hey, did we provide a service? Did we provide access to something? Are we getting an outcome? And really starting to align with moving measures and trying things. If the things we're doing aren't producing the outcome we want to do, how do we change the things we do? I don't know if Tyler or Tony have anything to add to that.
Yeah, and I think the biggest thing I want to emphasize is that when we started our ambulatory care program to get pharmacists more outside of the walls of the hospital, none of our pharmacists had any particular training in ambulatory care. I think when we talk a lot about it, we talk about residency programs and getting more experience through that. Tony's been the first residency trained pharmacist that we've had out in the clinic. Prior to me, it was another pharmacist that's been on our team for 10 years. We just had that drive to want to work with patients, and I had the relationships with the providers. So it does. A lot of the skills that we have inherently as pharmacists that we learned in school all put us in a really good position to impact patient lives and have active listening conversations with our patients to understand what's impacting them, and then have the knowledge base or the understanding of our resources to figure out how to help them. So we don't need necessarily any particular training to start making an impact. It's, again, building those relationships with providers and having that drive to want to make an impact on patient lives.
Yeah, and I can just round us out as the boots on the ground guy, and just say that, sometimes when we're developing these programs, we get caught up in formulating the perfect plan to execute and get the work done. And sometimes you just have to start somewhere. And I feel like that's kind of what we did with this program is, we just started doing the work and opened it up to the providers, and it really caught fire and, gained a lot of favor with the providers because of the services that we were offering. And it does require you, like Chris said, to stay flexible. If things aren't working or if you're not getting the outcomes that you're looking for, you might have to change directions. But always being open to feedback, and especially from the C-suite folks, and presenting your data, and hoping that the data that you're collecting is offering good outcomes. So but really it's about getting started. Just start moving.
Take a look at some of the questions that have been submitted by some of our attendees. And attendees, if you have questions, please submit them into the Q&A function on Zoom. So we're talking about developing programs, implementing them, and using pharmacist skills in different ways. There's a couple of questions that relate to exploring ways to incorporate pharmacy technicians into Fort Healthcare's population health program. So could you guys talk a little bit about how you're utilizing technicians to help facilitate the implementation of some of the programs?
Yeah, we would love to. Do you have any? That's the challenge right now. Honestly, if we had technicians to spare, I think we would love to do something with that right now. That's the challenge, and one of the challenges in rural healthcare delivery is we work with the team we have, and the team we have right now is more pharmacists than technicians, but we would love to have technicians and expand those roles.
And we've got a great strategy in pharmacy to build really strong technician tree, not just a technician career ladder. Hopefully allowing them to not only grow in their roles to beyond the standard pharmacy technician duties, but getting them involved in patient care, from medication histories to medication access programs like Jenny had said in the Q&A. Love to have that help, because as much as pharmacists have a wealth of knowledge on the medication access programs, they're not always the ones that need to be doing that. And I think it's a perfect spot to utilize pharmacy technicians, with the caveat being if you can find the technicians that are interested in it. I also think data analysis is a really cool opportunity that technicians could have to get involved in. It doesn't necessarily take a whole lot of background. It just takes a thirst for learning more and learning something new. A lot of the data work that we get involved in, we didn't have a huge background in before we started playing around with the numbers. So it's something that we could easily teach to a pharmacy technician and have them involved from an analytics perspective as well.
Question, interesting question. How do you reach out to bilingual patients or non-English speaking patients? I know you mentioned the clinic, Chris. I'm just kind of curious, challenges and how you overcome those challenges.
Yeah, it's challenging, and we continue to look at ways we can get better at that. Right now, we utilize a translation service right now that's available across our organization for translation. We'd love to hire more bilingual staff as we see opportunities to do that. Our community health clinic, of course, they have many more bilingual staff than we have, so they're able to reach many of those patients. When we do events that we know are going to be focused on those populations, we have translators present as well. Our latest mammography event, we had translators. But that is on our radar. We do want to make sure we're providing equitable access to all populations in our area. That includes when we do things electronically. We've recently did a refresh on our internet page, and we're building more and more bilingual aspects into that as well. So it is on our radar, and every day we're trying to get better with that.
This isn't a paid advertisement for the school, but I think the UW School of Pharmacy does a really good job of training the next generation of pharmacists to interact through translators. We had a student with us recently that went through that and was able to do a medication history using our translation services. And she actually utilized a lot of the skills that she had in the communications class to, make direct eye contact with the patient and just use the iPad service to talk with the patient. And then the provider came in and was able to pass right off to the provider to have their conversation too. So we do utilize those services really well, but I think, even as a student, they can sometimes be a little bit more nervous to get involved at the bedside, especially when it comes to, patients that are non-English speaking primarily. But the school sets pharmacists up well to communicate efficiently and with a human aspect in those situations where we might have a lot of communication barriers.
Yeah, and in our primary care pharmacy services, we don't shy away from consults for non-English speaking patients. We actually try to encourage our providers to send those patients to us. Only had a handful of those consults, but utilizing the translation service via phone, we were able to, communicate with those patients, and whether or not it had a huge impact on their health outcomes, we still were able to communicate and get medication access in some of those cases. So
there's another question that I think is really interesting. So when we think about rural health, rural counties, rural communities, access to providers and stuff. So what do you guys see as the role of telehealth or video conferencing for patient visits to promote access when patients are in, maybe more remote areas?
To be honest, I think that video calls would be probably one of the best things for a program like we have. One, because then you can see what the patient's home situation is. You can see them pull out their medications. You can see how they maneuver around their home. So you can kind of get a little bit more insight into how they are at home versus them coming into a clinic and seeing you in person. So I do think that there's a lot of value added there for those visits, for sure.
And we do have, oh, go ahead, Chris.
Well, I was going to say that to support that, it is recognized that many rural areas have poor access to broadband, and that's something being worked on actually at the community level right now that's come out of our community health needs assessment. So there is work being done at the county level on improving broadband access, and we're able to influence some of that work.
Yeah, I think the only thing I was going to add was, video visits are great, but we have a lot of patients that want to either come into the clinic and see us face to face, or a lot of the contact that they want to have with healthcare providers. They don't necessarily always want to drive to Madison, Milwaukee, or Janesville, even just because of, the traffic increases significantly in from their perspective. So they like coming to our clinic as it gives them social interaction from, their communities of 1,000 folks where they see the same couple of people all the time. So we like to have that connection with them, but we really try and offer all those opportunities wherever the patient's at, whether it's phone, video, or face to face. So a lot, and that's where I think rural health has the opportunity to really flex and meet the patients where they're at, because we get that direct feedback from patients. They want a video visit, they'll tell us, and we're able to make that happen.
Things like this always comes down to a lot of questions about funding, and Tony, you mentioned a little bit about billing for visits and things. So the question from an attendee is, how is your population health program funded?
Yeah, so right now, much of our funding much of our perspective is through achieving mission and vision related goals. We get some value-based reimbursement from many of these items. Diabetes care is one of those that's on our value contracts. So we look at outcomes there. And by being able to achieve some of those outcomes with pharmacists, it frees up provider time to provide other care. So that's right now the way we're looking at it. Definitely, we want to go down that road of getting paid for many of these services. But again, we wanted to start somewhere, and that's kind of where we are right now.
All right, last question we have, I think is a great question just about the overall approach here. So the question is, how does Fort Healthcare work on advancing population health among residents of Jefferson County who don't have any connection with your health system? Chris, you have that map that you showed on the second slide of the community all working together. Can you talk a little bit about kind of what you're doing for patients who aren't part of the health system?
Yeah, so, and I was alluding to that a little earlier, but our work with what we call the Rock River Healthcare Network, and there's 8 partners there. You got to look over at my poster here, and I can read them off there. So we have Fort Healthcare, we have the Greater Watertown Community Health Foundation, Jefferson County Health and Human Services. We got Madison Area Technical College, Rainbow Hospice, Rock River Community Clinic, Watertown Department of Public Health, and Watertown Regional Medical Center. So we work with all those entities on trying to solve broad population level challenges. And many of those things start with their community health needs assessment that we do in partnership with those same entities. So we have a pretty unique approach to the community health needs assessment in that respect. And then we work together on the challenges within that. Actually, I was talking to a data analyst from the foundation yesterday, from the Watertown Foundation, about trying to aggregate our data a little better and go beyond what we're doing. And so we're in those discussions. We started somewhere. We have what we have between us and Rock River. We have little other bits and pieces of it. And piece by piece, I think we're going to find ways to sew that together.
Are at time. So that is our webinar for this evening. And again, thank you, Chris. Thank you, Tyler. Thank you, Tony. What a great discussion about population health management. Also, I want to thank our attendees for attending the webinar. And please look for an email with a link to an evaluation survey so we can obtain your feedback about tonight's webinar. Also, please check out the School of Pharmacy's YouTube channel to watch the previous 6 pharmacy experts webinars. Also, if you have an idea for a future pharmacy experts webinar, please feel free to send that to me or Alyssa Carnegie at the School of Pharmacy, and we can begin to pursue perhaps producing that topic in a future webinar. In other alumni engagement activities, please check out the latest edition of Discover RX, the School of Pharmacy's digital publication. Also, please look for information to participate in the next installment of Virtual Trivia Night to raise funds for Pharmacy Alumni Association scholarships on February 6th. So everyone, please stay safe and healthy and have a nice evening, and on Wisconsin. Good night, everyone.